So these webinars, they're really meant to give you actionable insights that you can really start implementing immediately. And we will start out with Dr. Kyle Stanley. We're super excited to have him here with us today. A little bit about Dr. Stanley. He's a leading cosmetic dentist and educator, recognized by the American Academy of Cosmetic Dentistry and named among dentistry's top young educators and global doctors. A USC grad, he completed advanced implant training and residency in Brazil. He's a pioneer in dental AI as a co-founder of Pearl, a $400 million plus company improving patient care with technology. Dr. Stanley is a dedicated advocate for mental health within dentistry. He's an award-winning dentist, has empowered numerous dentists to combat burnout, fostering sustainable careers. Dr. Stanley has shared his expertise as a speaker on 6 different continents. We're super excited to have Dr. Stanley with us, and I will go ahead and give the time over to him.
Awesome, Carly. Thanks for having me. Hello, everybody from sunny California, although it doesn't look very sunny in my room right now. I'm going to share my screen and we will get the party started here. All right. So today I want to talk about the future of medicine powered by AI. And I say the future of medicine because I'm a dentist, but I know people from veterinary, from optometry, from aesthetics, from private practice medical doctors. So everything I'm talking about is applying to all of our practices. I may show some things that are specific to dental, but will still apply to your practices just in your specific sector. And I think after being in AI now for 10 years, when I started in 2015, one of the biggest questions, there's two real big questions that people ask me. They say, what are you missing out on if you're not using AI in your practice? That's probably the first one. And the second big one is, can AI help me in my practice today? Or is this just some pie in the sky future thing? Like, I think we all know AI is coming, but can it actually help me in my practice today? And so we're going to talk about both of those today. And this is going to be different and this is going to be unique. A lot of that has to do with just simply my experience with AI. I bring somewhat of a comprehensive global vision to my specific sector, and I think all of medicine as well, because I've had my hands in so many different areas. I taught at a university for 9 years. I've been doing research for the last 15 years. I do own a private practice. I'm the clinical director of a dental lab. I started a fairly large dental AI company, and now I advise and invest in about 12 different dental tech companies. So I've been involved with AI for a long time. I've built AI, I've deployed AI at scale. I've used it in my practice for the last 5 years. So I hope that some of this experience I can help you guys today. And my first question is, are you feeling overwhelmed? And I would probably say the answer is yes. And that is because in every sector, but these examples are in dentistry, there's a lot to learn. There's a lot of new technology coming out. There's a lot of new principles. In dentistry, we're thinking about, do we incorporate digital bite analysis? Do we incorporate airway? Do we start doing facial analysis? Do we do chairside milling, chairside printing? There's new biomaterials coming out. How are we analyzing faces for the best aesthetics? What other technology can we improve and bring into our practices? And it becomes overwhelming. Like, which one do we put our time, money, and effort to? And which ones do we take courses on? But I want to tell you, AI is different. AI is different from all these other technologies because of a few different things. It's plug and play. You get immediate benefit. It's fairly simple. You save time, and there's relatively low investment. So not a lot of these technologies can you say that about. But why do we need medical AI? I remember in 2015, it was around this time of the year, I was at my parents' house for Thanksgiving, and I told my dad, who's a dentist, practiced for 46 years, I said, Dad, I'm going to start a dental AI company. And he kind of looked at me and goes, do we need it? And I was like, ah. And I thought about it and I was like, Dad, could you have done it better? He kind of smiled a little bit and goes, yeah, I could have done it better. I could have made more money. I could have been home with you guys more. Could have reduced my liability. I could have gained more trust with my patients. Yeah, I could have done it better. He ended up working for my AI company, so it all worked out. But the problem is that healthcare has challenges. We have inconsistencies and inefficiencies. We have untapped data and we have unexplored business opportunities. And so let's go into each one of these a little bit. What if we could change from being inconsistent, inefficient to being efficient and consistent with our decisions? What if we could benefit from our data that we have? And what if we could maximize our business opportunities? And there's some other technologies that can do that too, but how can we do that with low investment and easy implementation? And that's the big difference with AI, low investment and easy implementation. So with this first one, inconsistencies and inefficiencies. I'll give you an example in the dental world. We did two studies on this. The first study, we asked 136 doctors to look at what's called an FMX, which is a full mouth series of x-rays. And we asked them to simply diagnose and treatment plan. And the agreement between these doctors was extremely low. What was even more surprising was the entire mouth treatment plan. So the entire mouth treatment plan ranged from $300 to $36,000 from the same patient. So imagine a patient comes to me and I go, "Oh, you need a filling, it's 300 bucks." They go to my brother who's a dentist and he goes, "Well, you need some root canals, some crowns." Okay, it's 10,000. They're like, I'm gonna go to the real Dr. Stanley." They go to my dad and my dad's like, $36,000. We got to redo everything. This doesn't look good for us. And these are some of these inconsistencies. We did another study where we took three different doctors and we had them look at about 9,000 images. They only agreed unanimously 4% of the time. We unfortunately did another study that I was a part of where we looked at doctors analyzing radiographs. We waited 3 months and had them reanalyze those same radiographs. And what we found was that we, including me, I only agree with myself 70% of the time. So these are some of these inconsistencies and inefficiencies. The next thing is untapped data. No matter what sector you're in medicine, you have a ton of untapped data. And I would guess in the last 20 years, you've digitized your entire practice. So in dentistry, we have digital radiographs. We have digital scans of the mouth. We have what's called an odontogram, which shows you which teeth are in the mouth, what's been worked on. We have digital chart notes. We have digital um, RXs. We have everything digitized, but we're not really getting better because of it. We're not learning because of it. We're not reducing our liability because of it. We've just gathered this data, it's sitting on our servers, and we're not bearing fruit from it. And that's what AI is going to do. And the last part are these unexplored business opportunities. I think this is a big problem across medicine. Whenever you have to run a private business, most of us go to school for, you know, 8, 10, 12, 16 years to learn how to do dentistry, how to do medicine, but we don't really learn how to run businesses. And that's actually where most of our stress comes from, not from doing the clinical work. We're pretty good at that. It comes from limited growth, poor patient experience, and lack of profits. And let's be honest, medicine's hard. I believe that we deserve to earn more. And one of the problems that we have is that we're not doing individualized care. We're doing things that are very blanket statement oriented. I'm going to do this treatment for everybody. But maybe that specific patient, it wouldn't work as well because of their genetics, their lifestyle, their medical history, their health and wellness monitoring. But even if we had all that data, it's too much for our brains. Our brains can't comprehend this much data. And that's where AI comes in. Another problem we have, especially in dentistry, and I know that it's in your other sectors as well, is we have a trust deficit. 64% of patients said that they don't understand what's happening in their x-rays, that they don't trust their dentist, that they've switched dentists to get a second opinion. There's a big distrust in medicine, and it's because we have financially driven diagnosis. The more we diagnose, the more money we make. So anything we can do to build trust is a huge, huge thing that I believe we should incorporate. So when we take this all into account, let's look at what we have with medical AI and what it is in an overarching standpoint. Right now, we have all of our data that you see at the bottom of this slide, everything that we've digitized. And now AI is this little layer between that data and the clinician. Okay, but we're going to move to a new point, and I'll show you that towards the end of this presentation. So with clinical medical AI, what can we do to be more consistent and more efficient in our decisions? Well, we have things like behavior tracking. In dentistry, we have toothbrushes that monitor where a patient is brushing and for how long. We can take that data and utilize that on how to treat them better, how to be more preventative, looking at their hygiene compliance, even doing remote exams that are analyzed through AI. All of this is feeding more of that data so that the AI can analyze it, make it easy for us to understand, and then we can just get the insights that we need. A super cool thing that's happening in the dental world, and I'm not sure if this is happening in the aesthetics world, but I would guess that it would be, is for case acceptance, we have AI predictive analytics that are helping with treatment planning. So it's previewing to the patient what is available and what they could possibly see. And these videos are taken from one single photo. It's not even a video. You take a portrait photo, the patient smiling. Within a few minutes, you can design their smile and then export a new video of what they're going to look like smiling and talking with their friends. And case acceptance is crazy with this, I have to tell you. On the diagnostic side, in dentistry, we do a lot of things in radiology. And so anytime we can take radiology and actually quantify it, it's a complete game changer. And this is what we did at my company. So now you can take an image that is normally black and white or smudges of gray and have something that is consistent, accurate, objective, and fast. So within a few seconds, you can have these types of readings that are showing the patient what's happening there and also quantifying it too. So looking at percentages, how far they've gone into certain layers of tissue, how close they are to the nerve. You can even colorize these images so that we can have these intelligent conversations with patients. You know, so many times in dentistry, and I'm sure it's the same in your sector, I'm showing my patient something and I'm going, you see this little gray smudge? You see how next to that there's this other gray smudge? And right underneath that, you're going to see a third gray smudge. And they're looking at me going, are these my toes? What am I looking at? What is this, right? And then we're wondering, like, gosh, our case acceptance is so poor. I wonder what it is. Our patients have no idea what they're looking at. And now we can say things like, you see, Mrs. Jones, this light pink area. You see how it's gone through the white and into the green. The green is a sensitive, spongy part of your tooth, and that's the reason why we need to do this filling in this area. How much more intelligent we could have of these conversations just by utilizing an AI tool like this. Now, when my company first started getting FDA approvals, one of the most incredible things we found was that when you take a dentist, and we're pretty good at reading x-rays, when you add AI to us, we always got better. And in our first FDA approvals, we got 37% more disease that was detected. Now, I want to be specific. This is not overdiagnosis. These are not false positives. This is disease that was previously missed that now we're able to find. So that means we're finding things earlier. We can be more preventative. It is less costly for the patient, less uncomfortable for the patient. What you see on the right side was our first round of FDA approvals. And notice the dentist, okay? So the dentist is in the orange little bars. We're pretty good at doing things. But notice that every time you take the dentist and you add AI to them, they always got better. Sometimes a little bit better, sometimes a lot better. But that's how I want you to think about AI. It's not the doctor versus the AI. It's the doctor plus the AI. It's just like autonomous driving. If you have an autonomous car that's not a Waymo, if you have like a Tesla, let's say, it can drive itself pretty well, but it's going to get in an accident no matter what. You have a human. I've been driving for multiple decades. I don't always get in an accident, but maybe once a decade I do. You take the human, you add AI to them, and they get better. We now have research to show that with driving as well. On the diagnostic side, you have interesting things that happen like this. So for anyone that is a dentist on here, you look at a radiograph like this, and we don't really see anything. I'll just tell you in case you're not a dentist. There's not really anything on here that we would treat. And my friend sent me this from New York. And then the AI was showing him that there was something interesting happening. And he did some more due diligence and he chose um, to enter this tooth. And what he found was a big carious lesion in here, a big decay that was unable to be seen by our human eyes. And you ask, well, how does the AI see it? And it's like that very famous book and very famous movie, 50 Shades of Grey. Okay. Not appropriate for this talk, but the title is 50 Shades of Grey. How many shades of gray can the human eye see? And we can see about 50. But the AI can see between 750, 850 shades of gray. So the AI is again allowing us to see things sooner, us to treat it more minimally invasive, save costs for the patient, do something that is less invasive. And that is something that I'm really proud of that we can do in our sectors. I think the more preventative we get, the more trust we gain with our patients. So a little bit of caution with clinical care. Don't defer only to the AI detection. So no matter what sector you're in, if you have diagnostic AI or assistive diagnostic AI, don't simply say, oh yeah, it said this, so I'm going to start drilling. No, still do your normal diagnostic vigilance. I wouldn't take disagreement with AI personally. I've seen this happen. Don't take it personally. Just know that it's like an extra person giving you an opinion. You can take it or leave it. Let's talk a little bit more about the business, how AI can help us in our businesses, in our practices.
Really quick, Dr. Stanley, we
Yeah,
had a question come through that I think is probably pretty applicable to everybody here.
sure.
Um, he said, how do you get staff to accept change and implement new things like AI?
Yeah. So that's one of the good things about AI is, first of all, there's usually not new hardware that you have to implement, and change management is very low. So for example, if we're just talking about radiographs, at first, when my company came out, it was a separate window that they had to look at. So all we had to say was, it is one more click. But with this one click, you get all this benefit. Most AI, I'll say most, has very little change management. And that's why it makes it so much easier to implement. Now, if you're talking about incentivizing team members to do things in a different way because there will be changes, I think you have to talk about the philosophy of the practice. You have to have psychological safety, which is something that I like to talk about, which is setting expectations that I want you to learn this by this time. I don't expect you to be an expert, but by this time next week, in 2 weeks, in 4 weeks, I would like for you to get to this level. And as you're explaining things, you're also explaining this is not only about you learning, but about me explaining. So if you have any questions, if there's anything that I'm not clear about, please come to me and let me know, or come to the front office or whoever it is that's explaining it and let them know. So I think it's about setting expectations, having good boundaries, and having good communication, which is what most of us suffer at, actually. So it's a skill, like anything, just like doing clinical work. It's a skill. Yeah, good question. So we can benefit from our data and maximize our business opportunities. When you look at the numbers, we have a lot of wasted time. You know, 3 hours is what the dental staff spend on the phone each day. 20% of patients no show for a dental office. Most practices have over $100,000 of accounts receivable. And the average retention rate in a dental office is about 41%. These are big problems. And I think what most of us do is say, well, I need to get more patients. If I just get more patients, then that'll solve everything. But sometimes what we found after incorporating AI is we didn't have to add that many patients. We maximized the patients that were there and kept the patients that were there. Because as you know, marketing can be expensive as well. So you can focus on the people that are actually there and really treat them the best, be more preventative, and keep them long term. So we've has a few different ways of doing this. One is helping front office team members be faster and smarter, having AI insights of what you're doing. So like if you miss certain surfaces or there's some different opportunities that you may want the doctor to take a look at. And also too, AI agents, I mean, these are things that are coming fairly quickly, is saying, hey, I've got two open hygiene visits next Tuesday. Can you find me the patients that are most likely to show up on a Tuesday for a hygiene visit? Oh, and search to find patients that have unscheduled work. I mean, this is something that sounded crazy a few years ago that will save so much more time and really maximize what we can do with our businesses. Especially if you look there's all types of tools out there in AI, but you have certain things where you can look at patients that are already coming in, having the AI analyze them and saying, are any of my patients that are coming in, do they have missed opportunities or do they have previously treatment planned treatment that is not scheduled yet? Because if Mrs. Jones is coming in to get a cleaning and there's a potentially missed opportunity and we have open chair time, let's get her in then. She doesn't want to take work off again. She doesn't want to miss, her son's soccer game. She doesn't want to get childcare again. She's already there. She would rather do it then. You would rather do it then. But sometimes these things just go unnoticed because we don't have the data. And now we finally have the data to where we can maximize the chair time. Even with recall, we have tools now, and again, Weave can help with this, that you can look and previously, if I said, oh my gosh, the first week of January is so light on my hygiene schedule, I would go to my front office and I would say, Lucy, the hygiene schedule is falling apart. Can you try to fill it? She would run a report on our practice management and just start calling, top to bottom. But now AI can take that list, reprioritize it on who needs the care the most. So she's going to fill the chair with high quality patients that need the care the most. They need it more than someone else who just needs an exam and x-rays. But from a financial standpoint, that patient is worth more. So they're filling the chair with higher production based on AI insights that are coming from different educational tools. And that I think is a really powerful thing. Of course, we know AI front office staff is coming, and this is not meant to replace your team. It's meant to allow them to be human, meaning they have to go to the bathroom. Oh, someone else can still answer the phone. They're not there till 8 p.m., but a patient calls with a broken tooth. Hey, we can intake them, get them scheduled for tomorrow. Even if they have a patient in front of them in the practice, I would personally rather them talk to that patient instead of saying, oh, excuse me, let me answer this phone right here. Right? So it's overflow is how I think about it. And what we've does with call intelligence, we've had this in my practice for many years. I know when we first bought our practice 12, 13 years ago, my business partner and I said, we're going to record our calls, and every week we're going to start listening to calls. Now, we did that for all of maybe 2 or 3 weeks. And then we're like, we don't have time to listen to every call. That's impossible. And we didn't have AI tools at that time. So when we heard about call intelligence with Weave, we already had Weave at the time. We're like, yeah, sign us up for that. It's listening to every call. It's listening to sentiment. It's finding, let's say, if the patient doesn't schedule, why did they not schedule? Do they need evening appointments? Do they want a certain product that you don't offer? Was it because of, this or that? And so you could actually get really good insights in a dashboard where it's all boiled down to you instead of just overwhelming data like how we were doing it, trying to listen to every call, which really isn't scalable. So we'll finish up here in a few minutes. The last thing that's kind of interesting is appraisal. I don't know how it is in your guys' sectors, but in the dental world, it's very old school, I think. Traditional valuations of practices were pretty much 70 to 90% of previous year's collection. So if a practice was doing $1 million in production, you'd pay 700 to 900,000 usually to buy a practice. But you could buy a practice that had a bunch of fraud. You could buy a practice that you paid a high premium for that has no more treatment to do. Everything's been done and there's no new patients coming in. Now, with the help of AI, you can look at all the data, so all the chart notes, all the treatment plans, all the radiographs, all the intraoral scans, and analyze what a practice is really worth. And I think AI will be the currency for practice valuation, and it's already started happening in about the last 2 years. That's going to be an interesting future because I don't like when people get ripped off, whether it's on the seller side, on the buyer side. I like when there's, true openness and everyone feels good about something going through, about a transaction going through. So a little bit of caution on the business side. Don't simply make business decisions only on AI insights. Still use all of your human brain. Remember, it's you plus the AI, not you versus the AI. Don't misrepresent AI's capabilities to your staff or your patients. Don't misrepresent how your practice is using AI. And then the future of medical AI. We talked about before how we had all of our data, we had this layer that was translating it, and then we had it, how it's being translated in an easy way to the clinician. And I believe that the next step is really automating that first layer. So much of the input layer that we have right now is being done manually. That is the charting, the x-rays, the scans, the prescriptions, the treatment planning. And the next step that's really coming this next year is automating all of that. And what that does is it allows us to focus more on the human in front of us. So I saw something that we've said that I thought was great, where they say, instead of doing paperwork, we're going to be doing people work. And I love that because that's why most of us got into medicine. We didn't get into medicine to be writing chart notes for 3 hours at the end of a patient day, right? And so automating all of that, then having it be translated and boiled down to something that's understandable and actionable that we clinicians and practice owners can do something about. And something that you should be proud of is that the first time a consumer experiences healthcare AI will more than likely be in your practice. It will probably not be in hospitals. It'll be in your private practice. And I think that's something that we can all be pretty proud of. So in this short message today, I hope I talked to you about the inconsistencies and inefficiencies that we have in our practice, the untapped data that we're all sitting on, and the unexplored business opportunities. And hopefully through AI, we can get to a place where we make consistent and efficient decisions. We benefit from our data and we maximize business opportunities. And so what's next? I would say motivate and inspire your team. Pick an AI champion. If you're wondering who the AI champion is in your practice, it's probably the person that gets in trouble for being on TikTok the most. So if you walk into the sterilization room and there's someone doing like a little dance, that is your AI champion, okay? Usually it's the youngest person in your practice. Contact an AI company, thank you to Weave for having me, and I know they're going to do a demo after this. And book a demo and see what's possible, who integrates with your specific practice management systems, your imaging sensors, all of the different technology that you have. And so if you're interested in anything that I do, you can take a picture of this. This has my courses, my AI company, my research, my speaking stuff, everything that I do here. And I would say thank you for coming and thank you for Weave for having me.
Amazing. Thank you so much, Dr. Stanley. Um, that was an incredible presentation where I know I learned a lot. So I'm excited to see what questions come through. We have a couple. What do you do to make sure that AI is 95% factual and reliable and not create a potential liability or an ethical dilemma?
Yeah, great question. I mean, the answer really is it's you plus the AI. So I'm a car guy, so I love relating it back to cars. You don't get into your new car that has self-driving and go asleep in the back seat, right? It's because we still need you. It's like if I came into your practice and said, there's a cavity there, drill. I hope you wouldn't just go, yeah, let's drill, right? You would still take all the necessary precautions that you would normally take. But now you have one other opinion. So is AI perfect? No. Are humans perfect? No. But we know from all the research, all the FDA trials, that when you take a human, you add AI to them, we get better. So are there ethical dilemmas that can happen with AI? For sure. It's the same with any technology ever. Yeah, could people show things to patients that don't need to happen? Yes. Can they also do that without AI? Yes. I mean, there's good apples and bad apples in every profession. But I think in general, the thing I want to put importance on is you are still the first opinion. This is a second opinion. This is an adjunct to you. This is an assistive tool to you. You are still the one diagnosing. You're still the one doing the treatment. You're still the one making the business decisions. You just have more data. You just have more insight.
Love that. Very well said. We have one last question, and then I'll turn the time over to Zach. But any information, advice on AI tools utilized for case acceptance, and kind of education on that?
Yeah, so there's two, these are on the dental side. One is called Smile Cloud. That was the one that I showed today with the patient smiling and having the little videos. The one that we use in my practice is called Smile Fi, which is like Smile FY. That's an app that we do smile design on, and then you can export that 3D smile design to a video and show the patient how to do that. So those have been great for case acceptance. The other one that I showed is my company Pearl. That's the one with the radiographs. So if you're a dentist and you take radiographs, then that is the has been a game changer for us. It's funny
Okay.
because when we built that, we built it for doctors, but we started seeing how doctors were using it to talk to patients so much more. And so it became not only a assistive diagnostic tool, but it became a case acceptance tool just because that was how people were using it.
Awesome. Love that. Great. Well, I will turn the time over to Zach. He's going to go over Weave and the AI touch points that we have throughout our platform and how you can utilize that in your practice.
All right. Thank you all for jumping in and taking time out of your day to visit with us. I'm really excited to show from a clinic perspective and from a customer-facing perspective how Weave helps communicate using both tools that are built for the staff and are assisted by AI. Um, Dr. Stanley mentioned a couple things. We see inconsistency and inefficiency in healthcare, untapped data, and how do we maximize our business opportunity? Weave helps all of those categories specifically at the front desk. So Weave is a software company that incorporates all of the systems in your office with the most important system, your staff. We can't replace people. So I want, as you look at this demo, to realize we are not in the business of replacing people. We're in the business of making people's lives better. And that starts actually with your staff. I want to help reduce burnout. I want to help reduce the amount of stress that your staff has. And ultimately, we want to make your practices as much money as possible. So, how does Weave do that? Well, we do that with a toolbox that allows you to start with the first interaction. That's at the phone level. So, Weave gives you a phone system that's built for a medical practice. Now, with our phone system, it links directly in with my app here. Now, when the phone rings at your front desk, everybody does the same exact process. What's your last name? What's your date of birth? Have you been seen here before? Weave is going to take that a step further. When the phone call comes in, it's going to pop up in the top right-hand corner of your screen. Now, the second your wonderful staff member answers that call, compare this to your normal process. Hi, Zach. Thanks for calling Pony Express Dental. How can we help you today? The second you answer that call, you have patient insights. For our vet offices, you have your patient insights. So it is dynamic where it will incorporate for your specific industry. From here, you get insights into their payments, into their patient database, their contact information, last visit, due date, and next visit. So that's just at the initial interaction. So you're greeting them by name, giving them a much more personalized greeting. Now, AI has changed the game because you can't answer your phone every single time. I called my dentist today. I was supposed to go to a dental appointment on Thursday. I called in and they happened to use Weave. They didn't answer their phone. Uh-oh. What's going to happen if you don't use Weave? There's a chance they're calling the next clinic down the road. There's a chance, like my wife, she broke her tooth the other day. She called an emergency clinic after hours. So there's potential loss of one, revenue, and two, trust. We talked about trust with Dr. Stanley. We want the patients to trust us. How do we do that? We communicate efficiently. So with Weave, we provide a tool that links in with your phones that's called TrueLark. Now, this is new to the Weave space and it's going to be scaled out over the next few months. But I'm really excited to show you just a little brief interaction on how this would work. So this company that I called, when I called to change my appointment, they sent me an automated text message. Now, what that automated text message would look like, you can see on the dashboard here. It's going to start a conversation. Hello, welcome to Halo Dental. How may I help you? Now, from here, I can say, hey, I need an appointment. Now, this is going to watch as it responds automatically. This is going to be designed to interact when your staff can't. Dr. Stanley mentioned maybe they ran to the bathroom. Maybe they're on their lunch break. Maybe this is at 8 o'clock when my wife broke her tooth the other night. This just gives you the ability to say very clearly what you need. Emergency, appointment, broken tooth. So even without proper punctuation, even without clear expectations, it's talking back and forth like a person. So this is step one of our AI. I'd love to get you more details. I could talk about this for hours, but we're going to wrap up shortly. So this just is going to give you a really helpful AI tool that is going to give you consistent, efficient results. It's also going to give you the data points that you need to make good business decisions, and it will allow you to maximize those business opportunities that Dr. Stanley was referring to. Now, he referenced one other feature, and I'd love to just spend just 1 minute on it, but that is our call intelligence tool. What call intelligence is designed to do is it's designed to link in with your phone system and record every single phone call, but give you not just a recording, because nobody has time to go back and listen to the recordings, but give you actionable reports and show you here a detailed AI summary of each call. It will transcribe the phone call and show you, hey, our staff member, Emily Davis, is the one that we're seeing maybe a few issues with or having a few trouble spots with. Maybe it's time for some education or some coaching. Or maybe Emily's doing really good and we could apply some of these things to other staff members. So this AI tool is really helpful for training, but on top of that, it catches those missed opportunities. Under the call insight section, you're able to see this was a new client that called in and they were unhappy. Okay, well, why were they unhappy? They were trying to schedule an appointment and they didn't have an open slot during that time. So now you're able to recover an opportunity. You're able to give that patient a better experience. You're able to put more money into the pockets of the business and you're able to grow. So with Weave, I know we are short on time, so I'm going to be brief here. Weave gives you a roadmap for every single touch point with your client, whether it's them looking you up online for the first time and seeing your great Google reviews, or they call in and it pops up the information. There was a missed opportunity, so Weave's call intelligence takes over. Our team chat for in-office communication, the facts, the practice analytics. We've built a system, and that's why we call it Weave, that weaves your tools in with your practice management software. We want your team to work smarter, not harder. We want your patients to have the best experience possible. So when they're dealing with the office, it feels like a friend and not a stranger. We've all had experiences in healthcare where we felt like a number. We want your clients, your patients, to feel like a valued patient that you love, that you care for. And Weave gives you the communication tools to deliver that. So we'll invite you to reach out and request more information on Weave. We'd love to share more with you. We can share a whole demo. You can ask as many questions as you need. But thank you so much for taking the time to visit with us today.
Awesome. Thank you so much, Zach. I'll leave it open for just a minute to see if we have any more questions pop through.
There were two questions, Carly, on the Q&A section that would probably be for Zach.
Let's see.
While we're looking those up, I do want to respond to David Wheeler. You asked earlier, and Dr. Stanley had a great response on how do you get staff to accept change and implement new things. We've all experienced where we implement something that doesn't go well. So whether you're looking at Weave, whether you're looking at Dr. Stanley's awesome tool, Pearl, ask yourself, is this simple? Is this easy? Because adoption hinges on simplicity. You can find the coolest tool in the world, but unless it's simple enough that your practice is going to actually adopt it, it doesn't really matter. Now, I can speak from experience with both Weave and Pearl. Both are very simple, easy tools to implement, and your staff will adopt. So simplicity is key. All right, what were the other questions that we saw?
The first one is, what would an AI-generated patient message look like? Would it just suggest appointment times, or would it also cover treatment benefits and clinical necessity?
I'm gonna read from my personal one with this AI generated conversation. Let me go to it really quick. All right, so I sent a message this morning. Hey, I want to book a cleaning for Thursday at 9 a.m. Please give me a moment while I check that for you. Sorry, but Thursday, December 4th at 9 a.m. is currently not available. Here are some times we have available on Thursday, December 4th for existing patient adult cleanings. 60 minutes. A, 10 a.m., B, 11 a.m., or C, suggest other days and times. So I just messaged back and said, hey, option B works great. Thank you for confirming the time. Is this appointment for Zach Beasley? Yes. Before we book, please confirm everything looks right. For Zach Beasley, existing patient, adult cleaning, 60-minute. It is a very seamless, easy to use tool, and patients love it because people in 2025, in about 2 weeks, 2026, want immediate results and they want easy results. They don't want a system that's complicated. These AI tools, as far as texting back and forth, are very easy from the consumer side.
Love that. And I'll just add, if there are questions that the AI can't answer, it will defer to a human. And if a human isn't available at that time, it'll schedule time for you to talk with a human. So that's a
Yep.
great question.
Complementing your staff. It's not to replace a staff. With people, when they hear AI, think, oh, it's replacing my job. That's not what Weave is designed to do. We're designed to complement your staff, and when it needs staff intervention, it will notify you, and it works really well hand in hand.
The next question, this might be something specific that we need to look into, but it says our company will be launching a business to consumer service to offer low cost labs, radiology, and oncology with ambulatory surgery to be added next. How would we assist with the B2C service? Um, yeah, I'll let you go ahead and answer that, Zach.
We book demos with individual companies where we highlight a game plan that would work for you. It's a no obligation demo. I'd love to talk to you more specifically about your business, about your client database, the opportunities where you're wanting to grow your business, and if Weave is a good fit for it. We're really honest. If it's not a good fit, we'll point you in a different direction. But we'd love to chat more specifically about your specific business over a personalized demo that applies to you. That sounds like a really cool business that's unique and niche. I think Weave can help, but just book a demo with us.
Perfect.
Thank you, Raymond. I will have our team reach out.
And I'm just copying down that info really quick. Okay. Any other questions before we wrap up? Just give it a minute to see if
Yeah,
anybody.
while people are responding, I'll just highlight one other feature here. With Weave, oh, let me share my screen again here. So with Weave, one of the big goals of Weave is to help you grow your business. So utilizing our Google review platform, this is a great way to reach out to those patients that haven't found you yet. The number one way to grow a business will always be word of mouth. The number two way, in my opinion, is Google reviews. So after your patients have reviewed you, Weave does a great job utilizing AI to help respond to those reviews. So once again, this isn't to replace you and your responses, but utilizing our system, when a patient leaves a review, you can come in and see how all of these here under reviews say replied. Now, this is really cool because Bert left this wonderful review for, let's say this was Dr. Stanley's page. Bert leaves this wonderful review. The job's not finished, as Kobe would say. You come in here and you can type out your own response, or utilizing the Weave AI tool, you just click on the AI button. This will create a response for you. Now you get to read it. We don't want to replace you in this. You read it and then you get to respond. But the AI is really designed to just be a part of every solution that you're working with. It's just going to complement everything you do. Complement, not replace everything you do and your staff does throughout the practice.
Well, thank you everyone for taking the time to be here. Thank you so much, Dr. Stanley, for your awesome presentation. And we hope everybody has a fantastic Tuesday evening. Thanks so much.
Bye, everyone.
Thank you all.
See ya.